Hello, my name is Mike Board, and I'm a registered nurse working on my bachelor's degree at Polk State College. I am planning on pursuing my master's degree upon graduation, and I have chosen to use this leadership conference to discuss nurse practitioners and their role in the nursing profession. I will be using a PowerPoint slide to discuss a little bit of the history of the nurse practitioner profession, as well as define the scope and standards of practice according to the American Nurses Association and the American Association of Nurse Practitioners. I will also discuss a little bit of the different types of ARNPs, as well as the specialties that you can become certified in. And then lastly, I'll use an article that will discuss how nurse practitioners are not only cost effective, but also beneficial to the nursing profession. All right, well, let's get started. The history of the nurse practitioner profession goes back more than 50 years. In 1965, Dr. Loretta Ford and Dr. Henry Silver developed the first nurse practitioner program at the University of Colorado. In 1973, more than 65 nurse practitioner programs existed in the United States. In 1979, the American Association of Nurse Practitioners is established. The AANP initiates the development of the National Nurse Practitioner Database. The AANP also plays a pivotal role in advocating for state and federal legislation, helping to define the scope of practice and eventually pushing for full practice authority. In 1999, approximately 68,300 nurse practitioners are in the United States. Today, there are more than 270,000. There are four types of APRNs: nurse practitioners who choose between 6 specialties to practice in, certified nurse midwives, certified registered nurse anesthetist, and then clinical nurse specialist. The common roles of the clinical nurse specialist include supervising and collaborating with other nurses and medical staff, typically in a leadership role, conducting evidence-based projects and research, consulting on system and patient quality improvement, and teaching and advising nurses in training. The 6 specialties that nurse practitioners and certified nurse specialists can certify in include family and individual primary care across the lifespan, adult gerontology, either acute or primary, neonatal, pediatrics, either acute or primary care, women's health, and psychiatric and mental health. The scope and standards of practice for nurse practitioners include performing physical exams, diagnosing disease states and medical conditions, developing treatment plans, providing counseling to patients and family members, overseeing registered nurses and other staff members, advising the public on health issues, helping patients manage chronic issues, dispensing medications, and offering referrals for specialized care and order and interpreting lab results. Eligibility requirements to become a nurse practitioner include completing a bachelor's degree program in nursing, called a BSN, passing the NCLEX exam, receiving an RN license, gaining a minimum of 1 year of clinical experience, earning a master's degree as an APRN, including clinical rotations, and then passing the board certification and applying for state licensure. An article from the BMC Family Practice Journal states that nurses are capable of independently conducting 85% of general practitioners' same-day appointments. They provide as high quality of care and achieve equivalent health outcomes as general practitioners. They contribute to reducing hospitalizations and mortality rates. And then nurse practitioners invoke high levels of patient satisfaction. The demand for the APRN is very high. The Bureau of Labor Statistics shows that 29,200 openings for nurse anesthetist, nurse midwives, and nurse practitioners are projected each year over the next decade. Job forecasts project a shortage of PCPs, increasing the demand for APRNs. Also, the increased number of states are offering full practice authority. Currently, 27 states offer this option without having to work under a physician's license. There's also an increased demand for higher education, as well as increased demand for telehealth and outpatient care. Thank you very much for watching this video. These are references should you wish to look this information up. Thank you again.